If you determine that 1. Any part of the order is incorrect or unclear, 2. The patient's condition would be made worse by the drug, 3. The person ordering the drug may not have had all of the information needed about the patient when the drug therapy was planned, or 4. There has been a change in the patient's condition and a question has arisen about whether the drug should be given. The drug should be withheld, that is, not given until the question can be answered and the healthcare provider called. Factors to consider in planning to give a drug. What is the drug supposed to do for the patient? Learn specific information about the drug, including the major action of the drug, the side effects that may develop, the usual dosage, route, and frequency, situations in which the drug should not be given, contraindications, main drug interactions, in other words, the possible influence of another drug given at the same time. If you think there is a problem with a drug order and the provider cannot be contacted or does not change the order under the question, notify the charge nurse and the nursing supervisor as soon as possible. Most hospitals have clear policies about whom to contact, how to report this problem, and what to do next. After you have the drug ordered and have decided to give the drug, include in your plan any patient problems that may increase the risk of issues related to the drug side effects. For example, a patient who has poor vision may have a risk of falling in an unfamiliar hospital or nursing home setting. That is important if you are giving a diuretic and the patient needs to go to the bathroom frequently. You need to plan ahead so that the patient can safely get to the bathroom. The importance of these problems may change over time as the patient's condition changes. Ongoing communication between nurses and the healthcare team is important to maintain safe, quality, and cost-effective patient care. Some other factors to consider in planning to give a drug is to plan for special storage or procedure techniques or equipment that is needed. Does the solution need to be shaken before given? Should the drug be refrigerated? Do you need a specific syringe, such as an insulin syringe? Special techniques for giving the drug, such as using an inhaler or not applying pressure to the site after giving certain injectable drugs. Develop a teaching plan for the patient, including what the patient needs to know about the drug action and side effects, what the patient needs to know to take the drug correctly, what the patient needs to report to the nurse or healthcare provider if there are any problems. Implementation involves following the care plan and giving the drug accurately to the patient. It requires that the nurse use the information learned about the patient and about the drug ordered. Watch for any changes in the patient's condition that may make it unwise to give the drug. In planning the patient's care, you learned why each drug was ordered, the drug's action, and how to safely give the drug. If you apply this knowledge during implementation of the plan, for example, if you are giving an angiotensin-converting enzyme inhibitor to a patient with high blood pressure, you will need to check the patient's blood pressure before giving the drug. If you are planning to give the ordered penicillin antibiotic, and you notice that the patient has a red rash on his or her chest and arms, you would withhold the next dose of the drug until you have reported the rash to the healthcare provider because it may indicate an allergic reaction. After you have carried out the plan, you will record in the patient's chart or EMR that you have given the drug. The 9 rights of drug administration, a major strategy for giving drugs to patients, is called the 9 rights of drug administration. There are 9 commonly recognized rights of drug administration that the nurse must always keep in mind. The first right, the right patient. Use at least 2 patient identifiers. The second right, the right drug. Check the drug label at least 3 times to confirm that it is the right drug. Third right, the right dose. Make sure that you use the right amount of the drug and double check the dose. The fourth right, the right route. Never change the route of administration without an order. The fifth right, the right time. Make sure that the drug has not been given recently or should be given at a time of day. The sixth right, the right reason. Does it make sense for this patient? And know your patient and the drug. The seventh right, the right documentation. Document after you have given the drug, never before. The eighth right, the right response. How is the patient responding to the drug? Does it work? The ninth right, the right to refuse. Patients have the right to refuse, and make sure to ask the patient to clarify his or her reason. Provide good patient teaching and documentation. The right patient. It is critical to identify patients using 2 identifiers such as an ID number, name, and date of birth. The best way to identify a patient is to ask the patient their name and date of birth. Many patients are at risk for misidentification. For example, those unable to effectively communicate with the nurse, pediatric, geriatric, critically ill, confused, and non-English speaking patients. Before you give any drug, make sure that you identify the right patient. The National Patient Safety Goals claim that the purpose of this approach is 1. Reliably identify the individual as the person for whom the treatment is intended, and 2. Match the treatment to the person. To properly identify the patient, you use at least 2 identifiers. Identifiers are information that is used to reliably prove an individual is the person for whom the drug treatment is intended. Identifiers may be the person's full name, his or her medical record identification number, birth date, or telephone number. These may be compared with the patient's identification bracelet, wristband, if appropriate. Healthcare agencies may specify the main identifiers to be used in the setting and/or use a barcode system to scan the drug to the wristband. For patients who are alert and oriented, asking them their full name and birth date and comparing the information with the medical record is a straightforward process. However, for those who are hard of hearing, confused, very young or very old, or critically ill, be sure to compare the name, birth date, or medical record number against the patient's wristband. Best practice is to directly ask the patient, "Tell me your full name." This is much safer than asking the patient, "Are you Joe Jones?" A patient who is confused may not understand the question and may say yes or no regardless of whatever that is his or her name. In the hospital setting, never give a drug to a patient who is not wearing a wristband. Some long-term care settings use photographs of patients to assist the nurse in identifying patients who might be confused. Never identify the patient solely by the room or bed number. A memory jogger of the 9 rights of drug administration might be here. memorizing 3 at a time. The first 3, the right patient, the right drug, the right dose. The next 3, the right route, the right time, the right reason. The last set of 3s, the right documentation, the right response, the right to refuse. You may have heard nurses in the clinical setting discuss the importance of the 5 rights, the 6 rights, or even 8 rights. Over time, nursing has continued to emphasize the essential components of safe drug administration, and more rights have been added. For our purposes, the 9 rights ensure that you identify the right patient and give the right drug and the right dose using the right route at the right time for the right reason. Then you use the right documentation to record that the dose has been given. You then monitor the patient to assess the right response. The final right is that patients have the right to refuse the drug. You might wonder how you can remember 9 rights. A runner who really enjoyed racing in 15K races said that he liked them the best because he could divide them into 3 5Ks. So it seemed easier. You can do the same with the 9 rights. This section reviews each right and explains the reasons each is essential for safety, quality, and cost-effective care. The right drug. Drug label is verified 3 times before taking the drug from the unit dose cart or shelf, before preparing the prescribed dose, and before placing the drug on the shelf or before giving it to the patient. The top tip for safety, reading the drug label 3 times. 1. Before taking the drug from the unit dose cart or storage area. 2. Before preparing or measuring the prescribed dose of drug. 3. At the bedside before you give it to the patient. Each drug that is prescribed for the patient has a particular intended action. You will need to make sure that you give the right drug. Carefully compare the drug order with the drug label. Do not assume that the correct drug has been sent to the pharmacy. Make sure that the drug is in the correct form prescribed because some drugs can come in multiple forms, such as tablets, capsules, and syrup. Many drugs have names that look or sound almost the same as the names of the drugs. These are sometimes called the look-alike, sound-alike drugs. The Institute for Safe Medication Practices, the ISMP, has published a list of easily confused drug names. The U.S. Food and Drug Administration and ISMP also recommend the tall man lettering system to reduce confusion for look-alike drug names. In this system, for example, Lamisil, and the brand name for an antifungal drug, is written as Lamisil with ISIL capitalized. This helps to highlight the part of the name that the nurse does not confuse it with Lamictal, an anti-seizure drug, written as LA, capital MIC, lowercase TAL. The tall man lettering system has been embraced by healthcare agencies as one more strategy to reduce drug errors. Drugs may come individually wrapped in a unit dose system package or as a prescription filled for one person. In rare cases, they may be taken from a unit stock drug. Sometimes the drug label has a barcode that is scanned by a computer. However it is packaged, you must read the drug label at least 3 times before administering the drug to the patient. On this slide, you can see it is an example from the Institute for Safe Medication Practices. the tall man lettering system. The handout was provided to you in class as a printout from the Institute of Safe Medication Practices. The right time. The considerations about the right time is the action of the drug, the hospital policies about time administration. So if this is a one-time daily medication administration, is it to be given at 9 a.m. or is this medication intended to be given once a day at bedtime, which would be at 9 p.m.? And then, of course, keeping in mind about the patient's routines. The drug order should say when and how often the drug is to be given. In many situations, you will work with the RN and/or pharmacist to determine the right time. Most healthcare agencies have guidelines that specify what time drugs will be given when they are ordered. Drugs given once a day are given at 9 a.m. You must be familiar with your agency's guidelines for general times of administration. Nevertheless, it will be important for you to report if the information suggests timing that conflicts with the usual guidelines. For example, some statin drugs given once a day should be given before bedtime for best effect rather than in the morning. If you have any questions, make sure to notify the RN or the healthcare provider. It is always better to ask the question than it is to risk a mistake. To be effective, many drugs must be given exactly on schedule, day and night, to keep the level of drug constant in the body. For example, if a patient is taking warfarin, an anticoagulant, to decrease the risk for blood clots, the drug must be given at the same time every day. Patients with infections should follow a very regular schedule to maintain a consistent level of the drug and decrease the risk of antibiotic resistance. You may need to plan around other patient activities when you give drugs. A patient with a newly diagnosed infection may need to have a blood culture drawn before starting antibiotic therapy. If the patient is scheduled for an ultrasound, you may want to hold giving a diuretic in the early morning, wait until later, so that the patient does not experience urinary urgency while having the procedure. As you go through each chapter on drugs, you will learn more on this topic. Factors to consider in giving a drug at the right time. Always confirm the last time the drug was given to avoid giving too much in too short a time period. Understand and follow the rules of your hospital regarding the times to give scheduled drugs. Check drug references for the best times to achieve the best drug absorption and to limit risk for interactions with other drugs. Give drugs at times ordered to help keep blood levels of the drug constant. Plan drug therapy while keeping in mind other diagnostic and laboratory testing that your patient may be experiencing. Drugs are usually given when there is the best chance for the body to absorb them and the least risk of side effects. Some drugs should be given when the patient's stomach is empty, and other drugs should be given with food to prevent gastrointestinal side effects. Some drugs require that the patient not eat certain foods. Others do not mix well with alcohol. Antacids interfere with the absorption of a number of drugs and therefore need to be given 2 hours before or 2 hours after taking those drugs. When a patient is taking several drugs, check to ensure that the drugs do not interfere or interact with each other. For example, some antibiotics can interfere with the action of birth control pills, and a sexually active woman taking both could become pregnant if she does not use another form of contraception. Whenever you are giving a new drug or one you have never seen before, use your drug reference to ensure the timing is correct. It is especially important to confirm the timing of one-time only, as needed, and emergency drugs. The nurse must be certain that no one else has already given the drug and that it is the appropriate time to give the drug. Narcotics, opioids, are often ordered as stat, meaning that they are given within a few minutes of the order, or as needed, PRN. Note that the patient's record as soon as possible that you have given a narcotic so that it is clear that the patient has been given the drug. Even though it may be tempting if you are busy on the unit, never leave a drug at the patient's bedside for him or her to take later. If the patient cannot take the drug when you bring it, you can return with the drug later. As a nurse, you must document the time the patient actually takes the drug. If you are not present when the patient takes the drug, you cannot document that. The right dose. The considerations are the patient's age, the weight, the health status. This includes the patient's normal lab work or recent changes in their health status. Proper equipment, proper drug form, proper concentration, and accurate dosage calculation. As an LPN, VN, you will want to make sure you are giving the right dose. The amount of drug to be given is typically ordered by the healthcare provider as a dose for the average patient. A patient who is older, who has experienced severe weight loss as a result of illness, or who is small or very obese may require changes in the usual dosages. Pediatric patients often have doses ordered based on how much they weigh. Geriatric or older adult patients may be very sensitive to many drugs and may require a change in dosage. If the patient has poor liver or kidney function, changes in dosage may be necessary for the desired effect. The healthcare provider may order a specific dosage of the drug when treatment begins and adjust the dose later based on changes in the patient's condition. Giving the correct dose of a drug also requires that you use the proper equipment. Insulin must be measured in an insulin syringe. The proper drug form, oral or rectal, water or oil-based, scored tablets or coated capsules, and the proper concentration, and that you accurately calculate the right drug dose. For high alert drugs, many healthcare settings have policies that require 2 nurses to check any drug dose that must be calculated, particularly for drugs such as narcotics, heparin, insulin, or IV drugs to reduce the risk for error. The right route. Routes alter the effects of drugs. Nurses must not alter the route prescribed for a drug without a healthcare provider's order. Drugs should never be left at a patient's bedside for them to take at a later time. Each drug must be given by the route. The drug order must state how the drug is to be given. The nurse must never change these routes without obtaining a doctor's order. Although many drugs may be given by different routes, the dose is often different for each route. The oral route is the preferred route if the patient is oriented, awake and able to understand, and can swallow without choking. In some cases, faster delivery or higher blood level of a drug is needed, and the drug may be given parenterally, subcutaneously, or intravenously. There may be special precautions for drugs given through these routes, such as how fast they can be given or in what dosage. Review your drug reference to ensure that you are giving the drug correctly. For patients with breathing problems such as asthma, drugs that previously were given orally can now be given by an inhaler. This decreases the number of side effects by getting the drug directly to where it is needed. In the lungs, you will need to teach the patient techniques to achieve the greatest benefit from the inhaler. Other routes that you will see in practice are drugs given as eye drops, ear drops, topical agents, or as part of shampoos. The most important thing is that you give the right form of the drug for the right route. The right documentation. If it isn't documented, it wasn't given. Nurses should only document what they have given. Document accurately after the drug is given. Increasingly, electronic health record and charting systems are being used in healthcare settings. Whether the nurse records giving the drug in a paper chart or uses an electronic chart, the basics are the same. You need to make the right documentation, record the time, the route, and site of administration. If parenteral, after you have given the drug, it is very important to record this right away. Do not delay or wait until later. As a tool of communication, failure to record means that you did not give the drug. In an emergency or when a drug is used only once or twice, such a failure is very important. The documentation must always list the drug given, the dose, and the time it was actually given, not the time it was supposed to be given. In some offices or clinics where immunizations are given, the policy may require that the lot number listed on the bottle be recorded in the patient's chart. Most charting systems include a place to record the patient's response to the drug. Any patient reports of problems or adverse effects must be noted in the chart and reported immediately to the head nurse and the physician. It is vitally important that you never record drugs that were not given or record them before they are given. If a patient does not receive the drug for any reason, notify the nurse in charge or the healthcare provider according to the policies of your healthcare setting. Following the rules of your healthcare setting and carefully following the rights of drug administration can reduce the risk for drug error. If an error is made, talking about it honestly and taking action to correct any damage is vitally important to protect the patient from harm. Acknowledging error is an essential and ethical part of nursing practice. The right to refuse. Talk to the patient regarding their reasons for refusal. Refusal may be based on a lack of understanding about the purposes of the drug. Note the refusal on the medical record. Patients do have the right to refuse the drugs based on the principle of autonomy, the right to self-determination. Although we recognize that patients can refuse, it is important to talk with the patient regarding his or her reasons for refusal. In many cases, refusals are based on a lack of understanding about the purposes of the drug, and this gives you the opportunity to teach or clarify information about the drug. Another example is a patient who refuses a laxative because he or she has diarrhea. Clearly a good reason. Whatever the reason, if the patient refuses after you have answered all of his or her questions, make sure to document the refusal in the medical record. In some clinical areas, such as some psychiatric units, patients may have a danger to themselves or to others. In other situations, know your state laws that allow emergency treatment orders. If there is any question, make sure to check with the RN or the healthcare provider. Evaluation. The process of determining the right response, looking at what happens to the patient when the nursing care plan is put into action, requires the nurse to watch for the best response to a drug, noting both expected and unexpected findings. Helps the healthcare team decide whether to continue the same drug or make a change. Top tip for safety: evaluate the response to drug. It is important to watch the patient and look for any signs of improvement or any side effects, adverse effects, or allergic responses. Evaluation is the process of determining the right response and looking at what happens to the patient when the nursing care plan is put into action. It is the appraisal of the treatment's effectiveness. Evaluation requires the nurse to watch for the patient's response to a drug, noting both expected and unexpected findings. For example, when antipyretics, drugs that reduce fever, are given, you will take the patient's temperature to determine whether the drug lowered the fever. When the drugs are given to reduce blood pressure, you will do regular blood pressure checks. For drugs used to reduce pain, you will evaluate whether the drug reduced the patient's pain according to your agency's pain scale. Evaluation of what happens when you give a drug helps the healthcare team decide whether to continue the same drug or make a change. Gathering such information is also part of the continuing assessment of a patient during the care that the nurse will record in the patient's chart. The nursing process may be seen as a circle. For example, the patient's temperature can be part of the evaluation step of the nursing process, but it may also be part of the assessment step when you notice that the patient's temperature remains elevated, indicating that the patient needs a different dose of the drug, a different drug altogether, or some additional treatment measures. The nursing process has been the systematic method used by nurses for problem solving to make safe clinical decisions since the 1960s, and measured on the nursing licensure examination known as the NCLEX for many years. Recent studies, however, have shown that many nurses, especially new graduates, do not consistently make safe, appropriate clinical decisions. Clinical decision-making, also called clinical judgment, requires nurses to translate their knowledge into practice. The National Council of State Boards of Nursing, also known as NCSBN, definition of clinical judgment is the observed outcome of critical thinking and decision-making. It is an iterative process that uses nursing knowledge to observe and assess presenting situations, identify a prioritized client concern, and generate the best possible evidence-based solutions to deliver safe client care. This definition builds on and expands the nursing process and indicates that clinical judgment skills are not linear steps that are followed in a particular sequence. Recognizing cues. Cues are elements of assessment data that provide important information for the nurse as a basis for making client decisions in a clinical situation. The nurse determines which data are relevant, directly related to the client outcome or the priority of care, and of immediate concern to the nurse, or irrelevant, unrelated to the client outcomes of priority of care. For example, you recognize the specific lab values that are critical to whether or not you administer the certain medication. Of the patient's lab work available, you determine which values are relevant to the medication you are giving. Analyzing cues. When using this skill, the nurse considers the context of the client's history and situation and interprets how The identified relevant cues relate to the client's condition. Data that support or contraindicate a particular cue in the client's situation are determined, and potential complications are then identified. For example, once you are aware that the patient has a potassium level of 3.5 MEQs per liter, consider the effect of giving a furosemide diuretic for the patient or the effect of withholding. Prioritize hypothesis. For this skill, the nurse needs to examine all possibilities about what is occurring in the client's situation. The urgency and risk for the client is considered for each possible health condition. The nurse determines which client conditions are the most likely and most serious, and why. For your patient with the potassium level of 3.5 MEQs per liter, there is a risk in heart rhythm disturbances if the furosemide diuretic is given and the potassium drops too low. Although the patient may need diuretics for the heart failure, it is a priority to make sure that it can be given safely. Generating solutions. To generate a solution, the nurse first identifies expected client outcomes. Using the prioritized hypothesis, the nurse then plans specific actions that may achieve the desirable outcomes. Actual or potential evidence-based actions that should be avoided or are contraindicated are also considered because some actions could be harmful for the client in the given situation. For the considered patient, holding the furosemide until plans are made to supplement oral potassium can prevent hypokalemia and allow administration of the diuretic. Take action. Using this skill, the nurse decides which nursing actions will address the highest priorities of care and determines in what priority these actions will be implemented. Actions can include, but are not limited to, additional assessment, health teaching, documentation, requested primary health care provider orders, performance of nursing skills, and consultation with healthcare team members. Recognizing the problem, you contact the healthcare provider with the information and receive an order for 20 MEQs of KCl orally to be given with the furosemide. Evaluate outcomes. After implementing the best evidence-based nursing action, the nurse evaluates the actual client outcomes in the situation and compares them to expected outcomes. The nurse then decides if the selected nursing actions were effective, ineffective, or made no difference in how the client is progressing. The patient avoids irregular heart rate, lung sounds are clear, and the patient has no peripheral edema. As mentioned earlier, the 6 clinical judgment skills build on and expand the nursing process. The following table shows a comparison in the steps of the nursing process and the essential cognitive skills needed for sound clinical judgment.